Hello and welcome to America Salutes. America salutes its veterans. That has become a very big topic. What are the issues that veterans most care about? Well, to help us discuss that today is Milton Schoen, Director of Hennepin County Veterans Service. Welcome.
Thanks, Judy.
And Clark Dyrud, Commissioner of the State Department of Veterans Affairs. Welcome.
Thank you.
And I am so glad you're both with us and we have a chance to talk about these issues. What's most important to you?
Well, I'd like to introduce Clark a little bit. Clark is a Vietnam combat veteran, served in the Army. He was a county veteran service officer, and he was promoted, and he ran the claims office in Fargo for the Department of Veterans Affairs. He was promoted to run the Fort Snelling claims office, and in that capacity, Clark worked on a team basis to train county veteran service officers to get us to work better with the federal government and to really take a team approach, and that's been his hallmark in that capacity, and now as a Commissioner of Veterans Affairs to get us all to work together.
So in other words, he's worked his way through the system, developed enormous leadership skills. They've not pulled you in from some other state and plunked you on the top. They took one of their own who had worked his way through this system and knows our veterans. Good. Glad to hear that. What are the most important issues to you when you take a look at the Minnesota State Department of Veterans Affairs?
Well, I would like to frame it in terms of what is the biggest myth about serving veterans and how that ties into the biggest problem. And I believe the biggest myth that we have in serving veterans is that we as a state, or Milt as a county, or the city, that we know where the veterans are or who is veterans. And that just does not exist, that knowledge. There is no list. When people leave the military, they have rights of privacy, they come back into civilian life, and no one knows who they are. So we are commonly asked, give us a list. We have this that we want to do for veterans,
nobody has to
and
sign
no
up.
one has a list. And that is the baseline problem then, is how do you reach out to veterans? And that is something that Milt and I are so intimately aware of. For 20, Milt, we go way back, since our beginning days. But that is our number one problem, is reaching out. How do you get the word out to veterans?
And as an example, when our National Guard came back from Iraq, we organized county veteran service officers, and we went down to Fort McCoy so we could sign them all up for VA health care and do a combat theater questionnaire for them and send that information back to their counties. But that was a Minnesota National Guard unit, and the command structure was here, and it was very easy.
What advocacy piece are you asking for from this?
Well, we would like to be able to get the information to have the State Department of Veterans Affairs get the names of people as they're released from active duty.
What stops you from doing that?
And also from the military reserves, which is something we don't get now.
What stops you from doing that?
When a person leaves active military duty, they are under the Department of Defense. And that's where the records stop. When they leave, there is the Department of Army, Navy, etc., does not send that list of recently separating soldiers now, or sailors now to be veterans. They don't send that anywhere. So what Milt was alluding to was this amazing program it was a partnership between people at the federal, the state, the county level, and it went out to this unit as it was coming back. And here was what was so amazing, is that every one of those people coming back from Iraq were enrolled in the VA medical system, the hospital.
Sure.
Now, that is unknown, unheard of. The average sign-up of new veterans is probably 20 to 30%. And here, 100% of the National Guard returning soldiers are enrolled in the VA hospital. They might not need it for the next 15, 20
but
years,
have their names.
But their name is there. When they're 60 years old and having some issues, they will be in the system.
Right. And the other thing is, when they came back, we didn't have a recession.
Right.
that employment was more plentiful and employer-based health care was there. And now we're in a time when the unemployment rate is rising, and it's much more likely that these individuals would need health care that was separate from their employment. And so it'll be more important, especially as in next January, when we have a big group comes back, that we're able to get them connected to these services.
Take a few seconds. This is a mouthful of a question, but I hear it from people all the time. And people coming back and their spouses or significant others or family don't understand the different things that occur. They don't understand what the state does. They don't understand what counties do.
People don't know the structure in the state and the federal government, and it's our job to get them the services based on whatever their need is. And the other piece is that people oftentimes don't ask for services, even if they're in need. We might get somebody who comes in and says, well, I want prescription drugs, and I don't have any coverage for that, and we'll sign them up for health care. In that conversation...
And we as who?
We are county veteran service officers, and or they may call the state and through the linkage line. But initially we find out they want health care, and ultimately we find out, well, they might have a service-connected disability, there might be post-traumatic stress disorder, there might be, a person may be eligible for benefits they're not aware of, but 80 to 90% of the benefits we get for people, they don't ask for.
Right.
So you have this whole new group of veterans that are coming home from Iraq and Afghanistan. Talk a little bit about their issues.
Well, here to emphasize or re-emphasize, Milt has just been talking about the reintegration of the National Guard returning soldiers. Remember, that is just a small part of the people who serve. And so if there is the people who are in reserve units in Minnesota, and so far, reserve units typically don't go over as a whole unit. They've gone over as individuals attached to other states. And then they are the people who serve on active duty. And they truly come back without any notice. They slip back into communities. So what we are trying to do is basically marketing. The analogy I've always used is, if you watch TV, commercial TV, you see commercials. And why is it that a same company will advertise day in, day out, day in and day out? There seems to be something in human nature that doesn't react to something unless it's right there. So if you are a veteran and you might need something, if you don't have a sore tooth right now, you're not paying attention to messages about dentists, for example.
What would you like to tell those veterans to do right now? What advocacy would you...
To come in, this show is originating in Hennepin County, and the logical place is Milt's shop, the Hennepin County Veterans.
If they live in Hennepin County.
Yes.
And if not, at the end of this show, we'll show them where to come in.
We've got the linkage line, that information, and the linkage line will connect them with their county veteran service officer.
Yes. And to ask questions, I think that would be the #1 message. Are you a veteran, or do you know someone who is a veteran? Just ask. Are you aware of anything? Have you signed up for anything? Have you looked into any benefits? There's an amazing statistic.
Because you're saying the reserves will always get signed up.
The National Guard in this state. National Guard
in our state.
In our state.
And the reserves?
Not so much.
Because you'll have a command structure. People will come from 20 different states.
Yes.
And there might be 6 or 12 from Minnesota. So it's harder to get that information. But with the state has done a lot of advertising for the linkage line and public advertising, and with the grant we got from the state, we've got brochures that we put in libraries, VFWs, Legion posts. We're putting in halfway houses and other places. We're trying to get non-traditional places to reach veterans, and that's what the department's about, to get the word out, to find veterans and to bring them to us.